spay and neuter is a very touchy subject with me because it's one of the things that I learned about 20 years ago. Okay? A couple of years ago, there was new information that came out against spay and neuter, and there's a reason why vets haven't been doing tubal ligations or vasectomies on dogs. You call around to all the vets in your area, and you see if you can find a vet that's willing to do a vasectomy or tubal ligation, even after all of this information came out. And a lot of times they're going to be laughing at you. I've had vets actually laugh at me for actually asking them to do a vasectomy on the dog. Okay, let's get into this video and see if he's willing to give you the informed consent that vets aren't giving you. Once, if a vet were honest and gave you a true informed consent about the side effects of spay and neuter, especially done early, you would tell him to go to hell. You're not going to get it done. Let's have a listen to this video.
Interesting. Oh, I didn't see you there. There's a new paper about the effects of neuter and spay on dogs' health and behavior. In March 2023, the Journal of American Veterinary Medical Association, JAVMA, published a new study. In the study, they did see a difference between spay dogs, neuter dogs, to intact dogs, and to dogs that had an ovary-sparing spay. Basically, they did leave the ovaries but took away the uterus.
Now, one of the big problems with spay, in general, when you remove the uterus, you're actually creating a big gap. Okay? Now, the rest of the organs got to fill that in. It typically has to be the bladder. There's a reason why 20 to 30% of female dogs who go through a spay procedure end up with incontinence and end up pissing on the floor all the time. Why are they even bothering taking out the uterus? Because of pyometra and stuff like that. But what is pyometra? Again, there's no informed consent. Pyometra is caused by E. coli. Where does E. coli come from? Dog food. I don't need to jump into that one right now.
In this channel, I talk mainly about behavior, so I'm not gonna...
And again, I'm going to ask you point blank, why don't you define the word behavior and explain to people what it is? Because once you do, you're no longer a vet behaviorist. That's the reality.
discuss the differences on the health, but
Yeah, he doesn't want to discuss health, so I'm going to discuss a little bit about health with you, okay? There's a couple of serious problems, and we're going to get into behavior as well. When you desex a dog, take the sex hormones away, the first thing that happens, generally the thyroid goes down and it creates a hypothyroid condition. And a lot of dogs don't recover from that. Now, hypothyroidism for most vets, and trust me, I've talked to a lot of vets over the years, and a lot of them are going, oh, hypothyroidism is overdiagnosed. They don't want to test for it. There's a reason for that, because the side effects of hypothyroidism is turning into a cash cow. Okay? One of the big side effects of hypothyroidism is that it mimics allergies to a T. Now get into Facebook groups and you watch how many dogs right now are suffering from unexplained allergies, and the vets will not push a thyroid panel. Okay? Even when dog owners ask, a lot of vets are going, it's overdiagnosed, it's a waste of money, here's some prednisone. Well, when your dog is on prednisone, steroids actually drop thyroid function further, causing the hypothyroid condition to get worse. Okay? Let's keep on going.
surprising. In this study, the researchers found that the longer the dog had his gonads, either because he was not spayed.
And by the way, they're pushing this as new data. This is new scientific data, new discoveries. Go listen to Dr. Karen Becker. Okay? I've been listening to Karen Becker for a long time. She's been talking about the dangers of spay and neuter for over 10 to 15 years now. This is not new data. Vets are all surprised because of all this new data, but they've been calling Dr. Becker fringe for the last 15 years. Okay? This is the reality. There's no informed consent. They will not tell you the side effects of spay and neuter, because once they tell you the side effects of spay and neuter, once they give you this informed consent, you will no longer do it, and they're going to lose their cash cow as a result of not spaying and neutering.
Or because they did what's called...
And how many vets in the last 2 years have converted to doing vasectomies and tubal ligations? They're still doing full hysterectomy and spay. When you pull a spay on a 3-month-old dog, you're taking that poor female dog and putting her right into menopause. There's a reason why they call it surgical menopause. And doctors don't push hormone replacement therapy. Why? When a woman has a hysterectomy, it's a hard thing to go through. They offer her hormone replacement therapy, estrogen, but for some reason dogs don't get it. Dogs don't get offered that. And our dog owners are on their own because vets won't touch it.
ovarian sparing spay kept the ovaries but removed the uterus, or males that had vasectomy, kind of like in people, they left testicles but they just made a cut in the vas deferens, the pipe that lets the semen go outside. They saw that in those dogs did have the exposure hormones, their gonads, by their testicles or by their ovaries. Those dogs were less likely to have all kinds of bad behavior. Either
That's actually bullshit. Vets and trainers are always blaming dogs' hormones. This is why they're pushing spay and neuter. Spay and neuter the dog. Monty was a basket case when I first met him. The trainer suggested they cut off his nuts at 2 years old to calm him down. It didn't do anything. It made him worse. There's a reason for it. Once you take a male dog. Okay, let's get into the more medical side of things when you spay or neuter a dog. When you cut the nuts off a male dog, you're taking away their natural ability to produce testosterone. Here's the thing, part of informed consent that dog owners need to understand. There's two organs in the body that can produce testosterone, and those are your adrenal glands. Your adrenal glands also produce cortisol and adrenaline. Now, here's the big problem with behaviors when you're dealing with aggression and reactivity. Once you cut the nuts off a dog, especially if they're reactive already, they're already producing a lot of cortisol and adrenaline. That's the very cause of the fight or flight response and the aggression and the reactivity you're seeing. Now all of a sudden you're going to light a fire on the adrenal glands because now they got to start pushing out testosterone that the dog needs to grow. That's the reality. And that's going to cause a whole lot of issues on their own. And once again, vets don't seem to like diagnosing hypothyroid conditions. So you keep that fire going. It's going to lead to adrenal exhaustion, which leads to what? Cushing's, Anderson's, cancer, and a whole lot of other side effects. Why don't vets tell people to informed consent? There's a reason for it.
Nuisance behaviors or problematic behaviors. And just so you know,
I have never experienced a dog's behavior being caused by hormones. That's the reality. Okay? All of the dogs that I've dealt with has always been a relationship issue. Fear-based. People, these guys can't even define the word behavior. I'm asking you point blank, sit down in front of a camera, Dr. Orion, and define the word behavior, people, and explain what it is. Because once you do, you're done. You're finished. Every dog trainer is finished. They can't define the word behavior. They won't because it's not efficient. It's not effective. They're going to lose money.
problematic behaviors were defined as aggression, anxiety-based behaviors, fears. Nuisance behaviors were urine marking, mounting behavior, normal canine behavior that are objectionable to many dog owners. And by the way, I'm going to link to the paper below. Its name is Vasectomy in Ovary Sparing Spaying Dogs, Comparison Health and Behavior Outcomes with Gonadectomized and Sexually Intact Dogs.
But you see, they're trying to link behavior and health directly to spay and neuter. Okay? The problem is it goes far deeper than that. Behaviors go outside of all that. That's part and parcel of it. But the thing of it is, you can't ignore everything else.
By Zink et al. So now you know, behavior issues were less likely to happen in intact dogs or dogs that still had their gonads. So, does that mean that you shouldn't neuter or spay your dog? Well, not exactly. We do have a lot of conflicting.
Okay, I want the excuses for you to turn around and cut necessary organs off a dog. I want to hear your excuses for coming up with cutting the testicles off a dog or basically mutilating a female puppy.
Data, different papers showing us different results. Most older papers actually show improvement in behavior issues when you spay or neuter your dog. But in
Where's those papers? I want to see those papers because everything that I've learned, spay and neuter causes a whole lot of harm in behaviors and medical.
many of the newer papers, we see just the opposite, or maybe there's no difference between dogs that were neutered that spayed and dogs that are intact. And I think it's going to take some time before we all agree, or most of us agree, on the right thing to do.
It's going to take a long time, yeah. Again, call around the vets, but all this new information out telling you point blank that intact dogs are far healthier and less behavioral issues, but they're going to take their time. Call around to every vet around your city and see how many are willing to do a vasectomy or tubal ligation. The problem is tubal ligation and vasectomy are very, very fast operations and they're cheap operations with a very, very quick recovery time. Again, when you spay a female dog, you're taking that dog and you're causing surgical menopause. And the dogs aren't getting hormone replacement therapy. They should be.
For every single dog. And why is that? I mean, we do have papers that show that not neutering or spaying actually helps the dog not have all kinds of behavior issues down the
There you go.
road. Now, you know I like science. You know that what I base my techniques on, the way that I help my patients, is based on scientific data.
Everybody's pushing science. Trainers push science. Vets are pushing science. Where is the science? Because everything that you're talking about science is absolute garbage. That's the reality. It's not hard to learn. But everybody's out, oh, trust the experts, trust the experts. This is not an expert. This man will not give you informed consent.
But in the same way that I critique the dog daddy, check out the link here, I also critique every single paper that I read. And I must tell you that this paper didn't really convince me. In order
Of course not, because there's no money in leaving dogs intact. Once you cut the friggin' sex hormone or sex organs out of a dog, you're guaranteeing sickness and illness down the road. But this is the informed consent that you don't want to tell people. And if you start telling people, they're going to tell you to shove it up your arse.
to get the results they presented, they used all kinds of different statistics. In my opinion, and I might be wrong because I'm not a statistician, if the researcher have to use complicated statistics, it makes me feel like
It's common sense. You're born with a set of testicles. You're born with a set of ovaries for a reason. They're supposed to stay in the body unless there's an absolute reason to remove them. But you know what? They're cutting off the dog's nuts like there's nothing to it. They expect you to do it. People are in there screaming, if you don't spay and neuter your dog, you're a bad dog owner. This is what's going on. But yet nobody understands the informed consent. Nobody understands the serious side effects of it. And vets are not telling you.
maybe they didn't get the results that they wanted in the normal way. But I will say that even the writers of this paper didn't claim that this is the only proof there is. They actually said that more data needs to be collected.
Oh yeah, people again like Karen Becker's been known about this for 10, 15 years. She's been screaming about it for 10 or 15 years, but you didn't want to listen to her. You're calling her friends. Don't listen to Karen Becker. She's crazy. And you're still pushing the idea, you know what? We still don't believe this. We're going to keep on doing spay and neuter so we can make our money. Why don't you sit down and do a tubal ligation or a vasectomy? There's no money in it. This is all an extortion ring. That's all it is. You got trainers out there right now pushing for spay and neuter. And guess what? As a result, vets are making off like bandits.
Another big thing that bothered me was that all the data that they collected was collected from a very specific group of people.
Oh, it's going to be. Here we go. Here now we got to throw some negative into it. Now we're going to try to denounce it. We're going to try to denounce all this stuff because we're afraid to lose money. The outcome of spay and neuter.
Those people are members of a group that, to begin with, believe that not all dogs should be spayed or neutered, meaning that there is some bad.
Oh yeah, vets as a collective believe in spay and neuter. But you know what? There's a group over here, a small group of fringe people that believe they shouldn't be. But listen to us, don't listen to them. This is what's going on. This is do no harm being shoved right out the window, being tossed right out the window. They're doing harm to make money long term. It guarantees that the dog will get sick. And they're doing a lot worse than that.
Bias here to begin with. If the same study was done with a different population, with a very random population of people and their dogs, and not necessarily all members of the same group, then I would trust the results more than I do from this paper.
Exactly. You know what? It's only a small fringe group like Karen Becker. Don't listen to her. She's done all the research. She's got a whole research bunch of people doing the same research. They came to this conclusion 10 to 15 years ago, but you don't want people to know that. That's the reality.
Results of this paper also add up to many other papers that we have that show that neutering and spaying might actually cause or be associated with more behavior problem and not less. Does it
It's common sense. I see it all the time. I see it all the time. And vets are the problem. Well, trainers are too.
mean that now I think that none of you spay or neuter your dog? Definitely not. I do think that in many cases you should.
There is absolutely zero benefit to any dog for having their nuts cut off or their ovaries and other parts being cut out. There is zero benefit to it. Zero benefit. That's the informed consent that people are not getting. There is zero benefit to cutting off the nuts off a dog. Okay? And people go, oh, the dog won't get cancer. Are you going to cut your child's nuts off because they won't get cancer?
Should neuter or spay your dog, especially depending on where you live or your specific dog and his issues. It's pretty complicated. Not behavior, but in this paper they did show again that there are actually all kinds of health issues that are associated with the neutered and spayed dogs.
There you go. He's admitting it. There's health issues associated with spayed and neutered dogs. But is he going to talk about it? Is he going to give you informed consent? Probably not. I don't expect it. He hasn't given nothing so far.
And less with the those that were exposed to the hormones from the gonads. But overall, dogs that were neutered or spayed lived longer.
Bullshit they do.
Think about that when you need to decide what you want to do. There are countries with
You see, there's all kinds of studies over the last few hundred years where people were actually, where men were actually neutered. Their nuts were cut off, and it caused a lot of issues for the person.
where neuter and spay is not the default. And those countries don't have a crazy boom of dogs that were euthanized or are straying the streets or anything like that.
Why are we euthanizing dogs? That's the other big part of behavior. This is the reason why I want you to define the word behavior. Because once you define the word behavior, guess what? Behavioral euthanasia isn't even an option, is it? But you probably know this already, but you don't want people to know it.
Meaning that we can do differently. Also, I do believe that there are some ethical issues if you spay or neuter your dog when you don't have to. In the end, it is an elective surgery. And many
It's not elective anymore. Vets are out there pushing for it. Trainers are out there pushing for it. Your dog is acting out. Cut their nuts off. Vets are doing the same thing. Behaviors are doing the same thing. Everybody's out there screaming, spay and neuter your dog.
people
It's not an elective surgery anymore. And you go into the Facebook groups. Again, if you don't spay and neuter your dog, you're being called a bad dog owner.
feel uncomfortable deciding if their dog should go under surgery, especially when the outcome is not that clear. So, what do you think? Do you think dogs should be spayed or neutered?
When the outcome is not that clear, this is called informed consent. But yet you haven't given shit for informed consent. There's been no informed consent. There's been no solid information given in this entire video from a veterinarian. And he's still pro fucking spay and neuter.
And if yes, then why? If no, why? Write it down in the comments. Also, if you
Oh,
like
you're going to get more than a comment from me. Have a good night.